Hi, I'm Alexia Amaral, and today I'm going to be talking to you about ADHD, which is Attention Deficit Hyperactivity Disorder. ADHD is a medical condition that occurs in the differences of the brain development and brain activity that affect attention, the ability to sit still, and self-control. The symptoms of ADHD is constantly fidgeting and squirming, has difficulty sitting still, playing quiet, or relaxing, moves around constantly, often runs or climbs inappropriately, talks excessively, may have a quick temper or a short fuse. ADHD often begins in childhood and can persist into an adulthood. It may contribute to low self-esteem, trouble in relationships, and difficulty at school or work. The life expectancy for a patient with ADHD is normal aged life. Some patients grow out of ADHD or learn how to self-control themselves once they are diagnosed. People of all ages can be affected by ADHD, although ADHD usually often is affected by early age children. Doctors can diagnose ADHD in children, often as a child, known that has 6 or more symptoms of inattention or hyperactivity on a regular basis for more than 6 months or in 2 different settings. The doctor will consider how the child's behavior composes with that of other children of the same age. Signs and symptoms of ADHD in adults can be hard to spot. However, care symptoms that are in early age life before the age 12 and continue into adulthood create major problems sometimes. There are treatments and care facilities for people with ADHD. You can go to therapists like a support group, cognitive behavioral specialists, anger management. There's also counseling for psychology, psychological education, family therapies, and applied behavior therapies. Medications that you can take, stimulants, enhancing medications, and different stimulants that will trigger the neurotransmitter levels, the heart rate, and blood pressures. They might decrease appetite and sleep. Other specialists are clinical psychologists, psychiatrists, pediatricians, and primary care providers. ADHD often appears to run in families, and research studies have suggested that there may be a genetic component to this disorder. Non-genetic causes such as abnormal brain development, brain injury, or environmental factors are also believed to play a role in the disorder. Is the patient ambulatory, which means can the patient walk? Patients with ADHD are able to walk perfectly fine. Some patients may fidget while they walk or have trouble standing in one spot. And since I'm a dental assistant, I decided to add in how should patients with ADHD be managed in dental offices. I responded with my own. Patients with ADHD should visit in the office in the morning because after a long day of school or work, it would be hard and difficult for them to focus and be able to relax. Patients with ADHD would also be very anxious and ask a lot of questions, which means that you should give them patients a longer appointment time. The condition would not affect the oral cavity at all, but the patient will try to talk and ask questions throughout the procedure. And I got all of my information from cdc.org under the ADHD tablet, and they were all these questions were questions and answers that people had asked, so I decided to focus on those.